Hello, my lovely audience. Welcome to Time with your beloved midwife, Candice. I am glad that we've met again to continue our discussion on the female reproductive system. Did you know that the internal organs play a huge role in the female reproductive system? Of course they do, and that was evident in the topic we discussed last week, which is the vagina. Today we are moving straight to another internal organ, which is called the cervix. And so to be part of this beautiful family where we learn together, have fun, vibe, and promote our health, you already know what to do. Kindly subscribe to the channel, like and share the videos, leave your comments, tap on the notification bell, and click on the video card as well. I love you so much for this kind gesture. Mwah. To the topic for discussion, the cervix. The cervix, although it is part of the uterus, its structure and function differ from the main body of the uterus, and it is therefore described separately, and so we will treat the cervix separately. Situation of the cervix. As I said, it forms the lower third of the uterus and is the area below the isthmus, which includes the internal and external os, and it enters the vagina at right angles. The vagina is also in right angle, just as the cervix, and is sometimes called the neck of the uterus. Yes, from the cervix you are moving straight to the uterus. So mostly, as I said earlier, if you don't take care, you think they are one, but no, they work separately. They all have their function they need to fulfill to the female reproductive system. Regarding the shape of the cervix, the cervical canal is fusiform, and the cervix as a whole tends to be barrel shaped. Yes, you know a barrel, just as you're seeing in the video. Yes, that is the shape of the cervix, but the cervical canal is fusiform. With the size of the cervix in adults, the cervix is 2.5 cm long, and as stated, it forms 1/3 of the total length of the uterus. During intrauterine life, however, it forms the greatest part of the uterus, and it is in the last weeks of pregnancy that there is an accelerated growth of the uterine body, and this is brought about by the high levels of maternal estrogenic hormones. Listen very carefully. At the time of birth, the cervix and the body of the uterus are approximately equal in size, and when the ovarian hormones are activated at puberty, there is further acceleration of uterine body growth until it is approximately twice the length of the cervix. The diagnosis of an infantile uterus in an adult woman is made partly by assessing these relative proportions, and so the uterus will always be bigger than the cervix until certain instances where they almost assume the same size. And so when we discuss the uterus in our next episode, you shall know the size of the uterus so that you'll be able to appreciate the distinctions very well. Gross structure, or the macroscopic structure of the cervix. There are about 5 parts that constitute the gross structure or the macroscopic structure of the cervix. The first is the supravaginal cervix, and that is the portion of the cervix which lies outside and above the vagina. Superiorly, it meets the border of the uterus at the isthmus. You shall know the isthmus when we begin discussing the uterus. The infravaginal cervix. The other one was supra. This one is infra. So it's the portion which projects into the vagina. And we have the internal os. We mentioned the internal os when we were talking about the situation of the cervix. And so this internal os opens into the cavity of the uterus. If we have internal, we shall have what? The external. So the external os opens into the vagina at the lower end of the cervical canal. And so the next is the cervical canal, and it lies between internal and the external os. Oh, this is so interesting. There is not much to be said. It's as simple as that. Next to be discussed is the microscopic structure of the cervix. There are 3 layers of tissue that forms the microscopic structure. We have the endometrium, and that is the inner layer. This endometrium is being arranged in folds, that is the tissue, and this folds is called the arbor vitae. The folds allowing dilatation of the cervix to occur without trauma. And so in multigravid patients, the arbor vitae becomes flattened out with successive pregnancies. and this may predispose them to what? To trauma. You get me? So that is why you need to plan your birth. You need to plan the number of babies that you have, and the number of babies should also correlate with your health so that you don't predispose yourself to complications. And we have the muscle. These involuntary muscle fibers are mingled with dense collagenous tissue, which gives the cervix a fibrous nature, and it is not possible to state relative proportions of each, since this appears to be dependent upon the hormone levels of each individual woman. And we have the peritoneum, and the peritoneum covers the part of the cervix which lies above the vagina. With the peritoneum, there is something beautiful about it, and that is have you heard cervical cancer? Of course you've heard, one of the commonest cancers worrying the women. And this cervical cancer is mostly or commonly diagnosed in this peritoneum. There is a portion of the peritoneum which continues a short distance into the cervical canal, and it meets the cervical canal at the endometrium, and so the junction where they meet is called the squamocolumnar junction, and that is the commonest site of cervical cancer. That's why I said this peritoneum has something special to offer us. No more of the cervix or cancer of the cervix may not be the topic for discussion, but because its commonest site being the squamocolumnar junction has already been mentioned, I would love to encourage all sexually active women to get themselves screened for cervical cancer. For many years, women in the 35-55 age group were considered to be particularly at risk of cervical cancer, but there has been an increase in the number of young women who have abnormal and even malignant cells diagnosed on cervical cytology, and I mean girls at the age of 16 presenting with venereal disease who have also had precancerous cells diagnosed at cervical cancer screening. And so please get yourself screened if you are sexually active. Support of the cervix. With support of the cervix, we have the transverse cervical ligament, the pubal cervical ligament, and the uterosacral ligament. They all support the cervix to maintain its immunity. The cervix helps to prevent infection entering into the uterus. Is there as a soldier, nobody can enter without being authorized. Cervix dilates and withdraws during labor to enable vaginal delivery of the fetus and placenta. It is one of the organs that means a lot to midwives. It means a lot to me. So you usually hear the midwife saying that they are at your cervix. Yes, it's one of the important organs to us. During delivery, the cervix returns almost to its non-pregnant state. This is all about the cervix, and this is where time will permit me to end today's lesson. Thank you for your time, for your love, and thank you so much for your consistency. I am so grateful. We shall meet again. Until then, take care of yourselves, promote your health, and share the video for others to learn. I love you all. Mwah.